Hope the new year of 2022 is going well for everyone. Now here's the news in details. Concerns have continued to be raised by Kigali City residents over people who willingly ignore the COVID-19 preventive measures in place, especially in places where large numbers of people gather. And there have been calls for the authorities to enforce the measures with more vigor.
It's not difficult to see people blatantly ignoring the preventive measures when you go to places like markets, taxi parks, bars, and in neighborhoods. Hence the reason why the concerns are being expressed. What is clear is that when unvaccinated vendors are denied access to the market, they simply sell their goods outside. They can therefore still spread the virus, which is why follow-up is needed on this problem. Refusing that they work in the market is not enough. Their activities should be monitored outside as well. The measures need to be enforced, and things like washing your hands with clean water and soap should be respected before people are allowed to enter. And also, it must be mandatory that people wear their face masks properly at all times. If we continue being complacent like this, the consequences will be quite severe. If people were to truly understand the seriousness of the problem, wearing their face masks properly would not be an issue. There is no doubt that the complacency lies among us, the general public, with people not listening to what the government is asking of us. Kigali City authorities say the time of being lenient against people who break the COVID-19 preventive measures has long passed, and urge all people to get vaccinated and respect all other measures in place as well. People should avoid unnecessary visits and journeys, because doing that usually results in you later getting a call from the person you went to visit saying they have COVID, and then you realize that since that visit you have sat down with 20 of your colleagues at work, boarded a bus that had 50 people on it, and attended a wedding with 60 people in it. Now add those numbers up and you realize that you have infected all those people because of those unnecessary trips, and they went on to infect others without a doubt. That is why the infection rate keeps spiking like this. We have preventive measures in place, so let us all respect them, lest in January or February we end up in another total lockdown. No one is ignorant of what we had to endure the last time that happened. Since the pandemic reached Rwanda in March 2020, it has killed more than 1,350 people, and the infection has again spiked because of the latest variant of COVID-19, known as Omicron.
Across the country, many families say they do not use mosquito nets because getting them is difficult, and the 2019-2020 Rwanda Demographic and Health Survey confirms that the figures of homes using the nets have fallen from 84% to 66% in the previous 5 years.
We spoke to people in the districts of Gicumbi and Rulindo in the northern province to ask them if they use mosquito nets in their homes. I have nets in my house, but they are getting very old. So we are waiting for them to give us others. They have started getting holes in them, because the more we wash them, the faster they deteriorate. The mosquitoes sometimes get in because of all the holes. Local nurses in the area told us that they collect information about worn-out nets so that they may be replaced, and there is an ongoing operation to have them replaced. The 2019-2020 Rwanda Demographic and Health Survey confirmed that the figures of homes using mosquito nets had fallen from 84% to 66% in the previous 5 years. The survey also found that 34% of all homes in the country do not have mosquito nets. Such information helps the authorities to plan accordingly moving forward.
Demographic Health Survey is an important report because it gives to the Ministry of Health and all partners and all sectors in the country where we stand in terms of achieving some key indicators regarding maternal and child health, but also some key other health programs like HIV, malaria, and nutrition. So we came to realize that we do still have a lot to do to improve the health status of our population. When it comes to talk about maternal and child mortality, we do still have a lot to do. First, with this report, we know root causes of poor performance that we have seen in some indicators, and we act accordingly. I think This is an important tool for planners, for decision makers, and for partners, because these data are credible, so they can give us opportunity for us to make sure that we mobilize all resources that are needed to go forward.
76% of homes in urban areas were found to have mosquito nets, and 64% of homes in rural ones. The highest figures are found in Kigali at 86% and the lowest in the eastern province at 59%.
Some truck owners and drivers say that these days they are having difficulty getting their RNP vehicle inspection certificate. On the other hand, the Rwanda National Police noted that a joint team has been put in place to assist those who need the certificates. Sam Kalisa reports.
Requirements to fast weld the infrastructure frame of their Fuso trucks from very expensive garages before they can get the vehicle inspection certificates, plus back and forth difficulties while taking their trucks for inspection are some of the issues highlighted by drivers and truck owners in the city of Kigali. You go for an inspection certificate and they ask you to fast weld the structure frame. They do not allow you to go to the garage you want. They decide a garage to which we're supposed to go to. They charge us about 3 million to weld the vehicle structure frame. The Rwanda National Police, which is responsible for issuing the document, stressed that a team has recently been set up involving experts from the Ministry of Infrastructure, private sector operators in the transport sector, the police, and other agencies to address the issue that was a matter of concern. The inspection team concluded that for a Fuso truck to be given an inspection certificate, there is need to fast weld the structure frame of that Fuso truck. Rwanda National Police spokesperson CP John Bosco Kabera noted that those who followed the recommendations from the experts team already got the inspection certificates, urging others to follow suit.
Nukwita ku nama bagiriwe na ministeri ibishinzwe ifite ubwikorezi mu nshingano zayo.
They should consider putting in place the considerations by the set team so that the vehicles can acquire the inspection certificates, because it has been evident that those who did it, their vehicles have been given inspection certificates. Fuso vehicles are the most commonly used vehicles in the country to transport goods and other products. Owners are required to get vehicle inspection certificates after every 6 months.
Incidents have become evident across the country of people contracting the COVID-19 virus, developing symptoms, and then wasting precious time going to traditional healers for treatment instead of seeing qualified health workers and doctors. Most of those people say they initially suspect that they were suffering from ailments, only to keep spreading the virus and then go to the hospital when they are so sick, some of them end up dying.
So this is a challenge. When we have someone who died from COVID in Rwanda, we do deep analysis to understand why did it happen. And we have noticed of recent that people who have recently died from COVID, they have spent a significant amount of time at the traditional clinic, at the traditional healer. So they spend time at the traditional healer because of cough, because of fatigue, because of nausea, because of vomiting. Yet these symptoms should trigger a COVID-19 testing. So this delay creates a situation whereby by the time they come to the normal, regular health system from the health center up to this hospital, they will be already too sick, and most of them, they die immediately upon arrival. So looking forward, what we are going to see, we are going to see how we can collaborate with the traditional clinics across Rwanda so that they assist in the early recognition of patients who would need to be tested for COVID and treated for COVID as early as possible.
Well, some residents of Rutsiro district say they benefit from tourism activities in the area, as the district administration noted it has prioritized community-based tourism. Sam Kalisa reports.
Samvura and Sarvoni are Rutsiro district residents. We found them clearing a small road in Kivumu sector of Rutsiro district. They are happy to do the work as it helps tourists use these small roads on the shores of Lake Kivu. We have to clear these roads so that tourists can pass in clean roads. Except these who clean roads, other residents in the area have set up hospitality businesses to help tourists, while others entertain them, while teaching them about Rwanda's traditions and history. Before I started this, I had nothing, but now I have 4 goats, so we are not where we used to be. I ventured into dancing for tourists. I have now bought a sheep, and it has multiplied. I have 3 sheep now, so my standards of living improved. Havugimana Etienne, the deputy mayor for economic development in Rutsiro district, says the district trains residents on how to make tourism more productive and increase the tourism infrastructure in the area. They visit and pay for different community businesses, and residents benefit from it, be it those who receive them or even those who guide them. We still have obstacles because some paths do not have guiding posts, but we are planning to solve that, plus establishing bridges where they're needed because they help tourists and benefit residents as well. The district administration noted that it has prioritized community-based tourism. Before the COVID-19 pandemic intensified, the area received between 300 and 400 tourists a day.
Thank you, Sam, for that report. Now, residents of various parts of Kigali City living along newly constructed roads meant to facilitate public transportation note that the infrastructure has improved their livelihoods and boosted development. However, some of those living near the 8 new routes that have been set up say that the buses are yet to reach their areas. These 8 roads have recently been approved for the inclusion of public transport, with some already making stops in some of the roads, as residents living nearby say that this has improved their livelihoods and development due to the smooth tread with other areas and traveling easily.
It has been a game changer for many because now people are able to travel to Remera at a low price. We thank all the institutions that were involved in the establishment of this project, including Rwanda, Kigali City, as this has helped us a lot. Motorbikes used to charge 1,100 francs to reach, but now we pay 310. Now people go to work smoothly. We haven't seen public vehicles arrive, and this affects us because it's still a challenge to travel to other places.
On one hand, some residents are still waiting for the implementation of public transport in some of these roads. We haven't seen public vehicles arrive, and this affects us because it's still a challenge to travel to other places. Drivers of the public vehicles say they have started to become accustomed to these roads, even though some of the locals are not yet aware of these new roads.
The first bus arrives at 5:50 a.m., the second at 6:15 a.m., the third at 7:30 a.m. In Gasogi, sometimes I only have 2 or 3 passengers, but the buses are always there at those times.
The Rwanda Utilities Regulatory Authority confirms that the new 8 routes were created in order to comply with the requests of the people living near these roads. The Director General of RURA, Dr. Ernest Salimana, says the reason some of the public vehicles were not using some of the roads is because public transport companies were still working on the technological facilities, and that by January 4th, they will start arriving.
What delayed the use of public transport in some of the routes was that public transport companies were still installing the tap and go technology in their buses. Otherwise, not later than Tuesday, buses will have started arriving in the remaining routes.
The 8 new roads for public transport include a route in Muyanje, Saint Joseph, Niwoi, Tuzinia Market, Muyanje, Kichukiro District, Kichukiro Center, Tuzinia Market, Karama, Novage, Janyuma, Remera Gasogi, Charuzinge, through Mulindi Market, Kanombe, Kibaya, Usanza, Samuduha, the route from Nyabugogo to Gihara Market in Kamonyi District, Nyabugogo downtown, and the Nyabugogo-Karuruma-Geramvura route. Public vehicles were expected to start using these roads on December 23, 2021. Well, there you have it. On behalf of the entire news production team, thank you for sticking with us. I'm Jane Mutoni. Bye for now.